Hi, everybody. So, I am doclqj. For those of you who do not know me, I am doing this video simultaneously live on two different platforms. I'm doing it live on my Facebook public figure page, and I'm also doing it live on YouTube. I was asked to do this video by a group of clinicians in which I am a part of, comprehensive group of clinicians. We're an international group. And of course, I know a lot of you have been affected negatively, um, have some personal stories and some family members who have been affected by the COVID-19 virus. And a lot of us have patients that we're seeing in and out of the hospital setting that are affected by this virus. And most people want to know, what is the most effective way for us to continue to provide services given the fact that the government is now taking a stance and in most countries to intervene and say, we are, you guys have to excuse my Michaely, which we're going to talk about in just a moment as well.
Mom, there's a wasp in here.
Okay, give me just a second. Tell Jaden to get it for me. And close that door for me. So, this is a perfect example, right? Primary example. And so I left my door open for an interchange because I want to give you guys a real life example of what happens, right? As I talk about some of this stuff. So the reason I was asked to do this, because a lot of clinicians are asking questions that are pragmatic. They make sense. The questions that most clinicians are asking is, how do we best serve the population of people that we're working with, and at the same time keep the same level of integrity in the business that we are in and the services that we're providing, and at the same time stay on top of the quality of service, right? And so what I want to emphasize, as a person who has been providing services via telehealth for a very long time, I do have my 6 hours telemental health training certification. During a state of emergency, you need to think about the most important thing: helping people. You cannot help people if you, and so if the population of people that you're working with isn't underexposed, or what we call a minimal risk population, you have to understand there's still a risk to somebody. And so you're going from house to house if you're a community clinician, or even if you're an office clinician, and you're allowing those people to leave their house and come into your place of business, and they're traveling, they're still allowing space for exposure and infection to other people. Understand that this virus is now it's now airborne. So it can live in the air for up to 8 to 9 hours. I know that you guys really don't understand that piece, but coming from the epidemiological piece side of me, that's how long it can live in the air. And there has been a lot of unreliable information reported, because coming from the very beginning, there was, the scientists trying to understand what they were dealing with and all of these things. But even at that point where they're trying to understand it, what you want to do is stay away from what you don't understand, so that you can be the best mode of protection against yourself getting the virus and your patients getting the virus. So you want to be able to provide services to your clients the safest way possible. You can do that by doing telemental health services. So the training is to give you guys an idea of what you need to do to not compromise the integrity of the business. And so I talked a little bit just now about why I left my door unlocked. So I'm now in my home office, right? This is my home office. It's a professional space. I wish I had the room to kind of turn everything around so you guys could see it, but it's a professional space. Everything in my home office looks just like a regular office. My children are not allowed in my home office. Your kids should not be allowed in your home office. You should have the double lock permissions for your home office, like every other space where you're allowing yourself the double lock provisions. And everything that applies to your regular office should apply to your home office space. And I want you to think about it like this. You can make very minor mistakes and then not even know it. Leaving my door open was me allowing you guys to see how easy that can happen. Because on top of me being a clinician, I'm also a mother. And so you cannot control the actions of your children. There was an incident, and I was going to talk about that. There was, I guess, a news reporter or somebody working from home at one point, and he was live. That's why I did this video live. And his kids came in, and his wife didn't know. It was so funny. I just loved it. But his wife did not know, that the kids had gotten away from her. I guess she was fixing lunch or something like that. I think that ended up being the explanation. Either way, they were behind him in the background and playing. He had no idea until he looked up in the background at his camera, and they're back there. He's trying to elaborate on what he was talking about global warming and these kinds of things, and they're back there playing. So you don't want to be in the middle of a session and compromise the integrity and the HIPAA and the privacy of the people that you're trying to provide services for. You want to make sure that you have a headset, okay? And so I have headsets, you guys. I have lots of them, actually. For those of you who don't know, I used to work for GCAL, which is Georgia Crisis and Access Line. So GCAL, for those of you who are clinicians who previously provided telemental health services and know really what telemental health is, that's telephone provided service. What most clinicians are being encouraged to do right now is show you guys a set of headset. These, okay, headsets. They're noise cancellation headsets. Amazing. You can order them online. Now, you can also use your regular headsets that are noise cancellation. What they do is they help you provide better services to your clients. So they're not like, hey, can you hear me? Can you hear me? Can you hear me? And you have great clarity as well. You can hear them really good. And it's eliminating the background noise on your end as well. So it's protecting whatever you have going on in your home from door to door, wall to wall. So you don't have to worry about that piece, okay? That's one thing. And that's a HIPAA requirement. A lot of people heard the president's address and those things in regard to HIPAA being lifted. That was in regard to medical doctors. And I want you guys to understand what the difference is in mental health and medical doctors when it comes to telemental health provisions. So the medical field on the medical side is just now moving into providing telemental health services, and it doesn't allow them to use their cell phones, personal cell phones, to provide that. Telemental health services via video feed has always been allowed for clinicians that are mental health providers to use their personal cell phones. You guys have always been able to use your cell phone because you have a secured platform that you log into separately that allows a double lock provision, and your client's information is confidential and is private. It's still not exposed to your cell phone external data. So what it's saying for medical doctors is that now they don't have to worry about, because what happens on the medical doctor end, the platform isn't as secure. So that's why those HIPAA restrictions had to be lifted for them. But they still do very much need to apply for mental health practitioners, because you guys have more than the typical ability to provide the services over HIPAA compliant feeds. So you have Zoom options. Zoom actually offers you free up to 45 minutes if you guys already don't have that in place for one-on-one video. It may be paid account, so I'm not sure. But what that does is protect the consumer against phishing, hacking, and that kind of stuff into the feed, allows the clinician to record sessions and allow you to share screen and do some other things. Like if you're a play therapist, a registered play therapist, if you're providing play therapy services for a child or something like that, you're still able to do those things with the kids. So it gives more, it provides more flexibility. Okay. That's why I push Zoom over Simple Practice. Simple Practice is definitely trying to move in that direction. They have incorporated the share screen. They've listened to a lot of clinicians that have been doing this for a really long time and using platforms like Zoom. And they're trying to improve. So if you have an EHR like Simple Practice, they have that on there. There is a guy, I think his name is Lenny Carter. He has another platform called True Circle. So if you don't have something already signed up, True Circle is an option to provide telemental health, and people can find you on there. It's also a listing-based service. So there are a lot of options, and I know for a fact that Lenny has a link for telemental health training on his site. So I want you guys to understand it's not as hard as you think it is to provide telemental health services that are HIPAA compliant within the standards of HIPAA. What you're doing is you're providing a safe surrounding and setting in a web-based environment, the same way that you do when you're in office environment. So you can have a face-to-face session, you're billing the same. Where billing gets complicated, is where you're billing for the actual telehealth services. So over the phone, because only crisis line services have the ability to bill and get reimbursed for over the phone conversations. That is, I think, where a lot of people are being confused, because you've always had the ability to do a face-to-face service, which if you look at your super bill or your EHR billing, it asks you if it's face-to-face. When they're asking you the location of the consumer, it's asking where they're in a home, at school, or whatever. They're asking you where that person was. And so that's what you're listing on that documentation. So having a really good understanding, and I have a clinician, what is that class that I have coming up? A new clinician crash course, something like that, for people that are coming out of school that kind of goes over this stuff. But I wanted to cover this. So video, face-to-face interface, you want to make sure that the HIPAA concerns are basically privacy on the web, because you have a link. It's a secure environment that is hack proof and phishing attempts are protected, which is why you're using something like Zoom, Skype, even though a lot of people have been saying a lot about Skype. Skype actually was the first HIPAA compliant behavioral health telemental health service. I'm not a fan of Skype. I've just never been, but they were. Zoom came after that. But Zoom is great. I would say use Zoom if you guys are looking for something, and it's ZOOM.us. Privacy in the environment. That's the big one, okay? And then I'm going to end this video. So privacy in the environment means that the consumer understand they must have closed doors and nobody is coming in and out of the rooms that they are intended to have their session. You must advise them prior. And there is a telemental health consent form for them to sign. You should have an additional telemental health consent form for phone and web-based face-to-face interaction. And if you use Simple Practice, it's already kind of embedded in there. But your door should be closed and locked in your office, or closed with a sign that says do not disturb. The same things that you do for your in-office environment, you should do the same for your in-office environment when you're providing telehealth service. But when you're at home, make sure the door is locked so that your sessions will not be interrupted. And if the door is unlocked, just make sure you have headsets on. headsets are always the safest way. Um, I have a telehealth appointment starting shortly. But so no ins and outs of family members are allowed. That's something you want to make sure that you explain to the consumer. You want to make sure that if you guys want to get a pen really quick and write this down verbatim, you can. I'm going to sound a little bit like a teleprompter or recording. You want to make sure that you let them know that this call may be, or this video session may be recorded for training purposes, but also for tracking purposes, and to provide a HIPAA compliant um, HIPAA compliant and to improve the efficiency of services moving forward for you as a consumer. If you do want to opt out of the recording at this time, you may do so at this time. So you start your session off with the record button, but if they no longer want the recording to be made, you can stop the recording at that time, because it's often misconstrued whether or not you got everything that you needed and the tracking was done properly when you're doing a video session, because sometimes clinicians will track and sometimes they'll write down their notes on a tablet when they're in person physically with a person, but they may get off track and not do that when they're doing a video session. So sometimes it's better to have the video recorded. But if the consumer doesn't want that to be recorded, you want to make sure that you get it on recording that they asked for it to not be recorded, okay? And then you stop recording at that time, but you can still do your tracking on your log as usual, whatever you use to take your notes in session. So no ins and outs of the family members, and let them know that headsets are a requirement and they are required to keep their video on at all times so that you can make sure that they are safe and that they are not a threat to anyone else. Telemental health services are typically, and this is the biggest one, they are typically only provided to consumers that the clinician can ensure are not an imminent threat to themselves or other people. Having the requirements lifted in the way that they have been lifted in the behavioral health sector now allows clinicians to use their good faith judgment in making appointments happen on an initial assessment basis. So basically, your initial BHA, behavior health assessment, or biopsychosocial assessments now are able to take place without you making sure of that fact. But I would caution any clinician that wants to make that initial assessment happen without at least doing some type of a written assessment or sending forms forward to assess for threat to harm or potential to harm self first. And typically what I do is I use EHR, simple practice. So I send forward the forms for the PHQ-9. I have a digital form of it that I've already created inside of my EHR. I send that forward along with my intake questionnaire, and I let them fill that out first. And that tells me whether or not they can do a video appointment for their initial BHA. So those are some of my tips. I've covered everything that I needed to cover, and I got about 5 minutes before I got to be in this session. So if you guys have any other questions pertaining to this topic, you are free, more than free, to send me the messages to my inbox. The other thing is they can always download Zoom for free, and it's always free for them on their cell phone. So if you don't already have that interface, they can get that on their phone. And Zoom also allows them to call in if they don't have a data plan. And it's also end-to-end encryption. That's what makes it so great to use. So that's all I've got, you guys. I know I said I would take comments and stuff, but I can't because I gotta go. So leave me what you got if you have any questions, and then I'll make sure I get back with you guys after 7. all I've got. Later days. I hope it's been helpful. You can like and share the video as you need be. Okay.